Because a child's brain, their central nervous system, doubles in size during the first year of life and continues growing and developing at that rapid pace for the first 3 to 7 years of life, making sure this system is working at full function is simply the most important exam and assessment any pediatric provider could ever perform for your child. So while traditional medicine is going to rely primarily on symptoms and looks for obvious pathology on standard exams like blood work or MRIs and EEGs, our practice uses an incredible piece of technology called the insight scans that accurately assesses the health and function of your child's nervous system, central nervous system. If your child struggled with colic and frequent crying as an infant, ear infections, excessive tantrums and meltdowns as a toddler or preschool age child, motor coordination and speech delays, sensory processing and emotional regulation challenges, ADHD and anxiety type challenges later on, these are all signs that point to a stressed out, tense, and stuck central nervous system. Sadly, most pediatricians dismiss most of these challenges as normal and tell parents still today things like, don't worry, they're just going to grow out of it. Well, we now know that for most kids, those symptoms and conditions are obvious signs of trouble brewing in the central nervous system. When we get into things like technology and neurology, many of us can get overwhelmed, right? Confused or disinterested quite quickly. But that's the beauty and practicality of our insight scanning technology that I want to show you. It's super simple and easy to understand. My name is Dr. Matt Dirksey, and I specialize in neurologically focused pediatric and family chiropractic care. This video is exactly for parents who are searching for an objective test that will show them what is going on within their child's nervous system. Parents are going to learn exactly what electromyography is used for and how pediatric chiropractic can help, right? So the nervous system is a two-way street. One set of nerves are called sensory nerves that send information and report to the brain and brainstem precisely what's going on inside the body, internal environment, and outside the body, external environment. The other set of nerves is more of what is termed motor control nerves that send signals out from the brain and spinal cord and tell the various parts of the body what to do, when to do it, how to do it, etc. So because neurological communication within the nervous system has to do this vitally important job for tens of millions of cells in the human body, things need to happen fast and have absolute clear lines of communication. We were designed to operate well past 5G long before it was invented, and we certainly cannot have our kids operating at dial-up internet speeds. This particular scan in the background here, called the EMG or electromyography, is vital for us to help our perfect storm kids best. It serves as the most important form of testing we can do when conditions like autism, sensory integration disorders, ADHD, and anxiety are what's being investigated. That's because each of these neurodevelopmental and neurosensory challenges are rooted back in stuck tension and altered tone and exhaustion of the neuromotor system. Most parents of a child on the spectrum or who struggle with sensory sensitivities are familiar with the word tone. Okay, having worked with outstanding other professionals like pediatric PTs, OTs, and speech therapists, neurological and tone challenges are a big deal, as motor function and development determines brain function and development. That means if the EMG scan detects patterns of stuck tension and imbalance, the brain is almost certainly stuck in sympathetic fight or flight tone and also struggling with an imbalance between its core functions of regulating motions, behavior, learning, and memory. Right? There are 3 common findings with pediatric EMG scans, and we'll briefly describe them here and then show examples of each type below. We have the raging bull. This is a child whose nervous system is stuck on the gas pedal and entirely sympathetic dominant, leading to challenges with things such as hyperactivity, impulsivity, anxiety, difficulty sleeping, and so forth. Drunken bull. This scan finding most often correlates with a child struggling with coordination, focus, reading comprehension, communication, etc. A raging drunken bull shows up as a child gets older, often they'll end up with both scan patterns and signs and symptoms of each. The most exciting thing about neurologically focused pediatric chiropractic is that we can see changes in a child's EMG scans quickly because their nervous system is still learning to grow and adapt at such a fast pace, right? Their brains and bodies are growing and developing rapidly. It's quite incredible. But that also means that when subluxation gets into the neuromuscular system, as shown on EMG, it can wreak havoc and alter their development for years to come. So diving a bit deeper into this particular scan, our Insight EMG scans also use a 3-step scoring system that allows us to really understand what's going on with that child's neuromotor system and thus overall brain and neurological development. Here are the 3 scores you'll see on your child's EMG scan and a quick explanation of what they mean. And then we've provided some examples of the EMG scans as well. Total energy score. This score tends to go way up in a child who's wound up and stuck in sympathetic mode. And therefore a high score here is most often seen with our raging bull cases struggling with things like anxiety, behavior, and sleep issues and so forth. Okay? Pattern score. This is a significant score to the overall neurological tone, and a low score here indicates a child who's likely struggling with emotional dysregulation, focus and concentration challenges, postural exhaustion, and weak core, and so forth. Symmetry score. This score measures the balance between the right and left sides of the neurospinal system, which is crucial to be sure that there is balance in overall brain function and coordination. The Raging Bull High Total Energy EMG scan, the number one thing that signifies this child's scan as a Raging Bull scan is the excessively high total energy number shown in the bottom left. In this example, it's 413.8. The normal score should be 100. This means her entire neuromotor system is fully locked into fight or flight tone and interfering with her neuromotor development, standing, walking, etc., sleep, behavior, emotions, digestion, and more. So interestingly, this child is also a drunken bull as shown by the other 2 low scores. Drunken bull, low pattern and symmetry EMG scan. So for this child, I'm going to swipe here. For this child, low, 24.2, signifies she's struggling with drunken bull type neurological challenges, emotional regulation, sensory processing, motor coordination, digestion, and so much more. The Insight scans do exactly what they're named for. Give us insights and an understanding of the most crucial aspect of your child's health in ways no other health practitioner can, right? The nervous system truly is the mom of the entire body, keeping everything and everyone on track at all times. And just like quite a few moms, it can get wound up and worn out. But it truly doesn't have to be that way. At Healthstone Chiropractic, we will put together, or already have, a fully personalized and customized care plan just for you. With each adjustment during that restoration or wellness care plan, you'll see the stuck stress and tension leave your child's body and the calm, relaxation, and healing capacity kick in. We can't wait for you to experience miracles that only neurologically focused chiropractic can bring to your child's table.